All right, you guys, August 26, 8:10 a.m., early in the morning on Thursday, another NPRnews.org article, the COVID-19 section. Some COVID-19 tests come with a bill. Here's how to avoid one. Article by Catherine Reichert of Rochester, Minnesota, published July the 8th, 2020, 9:49 a.m. Let's check the photo. Okay, we see people out here giving the saliva test or the saliva swab. Elizabeth Santoro, a medic with the Minnesota Air National Guard 133rd Medical Group, administers a free COVID-19 test to Thomas Harmon at the Minneapolis Armory on May 23rd. Aaron Levinsky by Star Tribune via AP file. Let's move on. Updated at 11:56 a.m. For weeks, Minnesotans have heard from Governor Tim Walz and high-ranking public health officials that getting tested for coronavirus should come at no cost. But on the ground, that's not always how it's working out. Hillary Rausch of Rosemont heard public health officials say that anyone who participated in mass gatherings surrounding George Floyd's death should get tested for COVID-19. So after volunteering to bring donations to neighborhoods affected by the protests, Rausch found a Burnsville clinic in her insurance network where she could get tested, but she had to pay $75 online before coming in. This is not a shock. Let's read these, the footprint here. Coronavirus tests. Insurers may only pay when they're medically necessary, not a surprise. More. Early coronavirus testing restrictions led to some big ER bills, also not a surprise. This is another side of the coronavirus testing that you really don't hear about if you guys think about it. What have you heard about the cost of a coronavirus test? Nothing. You see, now imagine all the people who are now unemployed and do not have health insurance. How are they going to pay for these coronavirus tests? But moving on. There was no option to submit insurance, she said. Wow, I'm not shocked. It was if you're coming here, you're paying $75. Okay. Rausch filed a claim with her insurer, Blue Cross Blue Shield, and at one point in time, Blue Cross Blue Shield was one of the best health insurers in the United States. I know because I had them. And is waiting to hear if she will be reimbursed. You won't be, sweetheart. Minnesota's insurance plans committed. Okay, there's another plane. Let me let it pass by. Minnesota's insurance plans committed to waiving costs for testing and associated visits. But as guidance around who can get tested changes, it appears some people are being billed for their tests or being told they will be billed, which has the potential to put a chilling effect on the state's efforts to get an accurate picture of the pandemic. That's absolutely correct. Rausch, a teacher, worries that not everyone has the means to pay those charges or has the time to fight them. I'm very lucky right now. I have the summer off. I'm able to look things up on my computer. I have $75 at my disposal, she said. Those are privileges I have right now. Not everyone can afford that or have that at their disposal. And that $75 most likely is not including the copay you're going to pay when you go in there. Minnesota Department of Health Policy Director Diane Rydrick said the state has done a lot to make sure the cost isn't a barrier to testing. Let's find out what they've done. Breakthrough announcement. Minnesota unveils major COVID-19 testing effort. That was my previous article. Officials say COVID-19 antibody testing is crucial. Of course it is. Our health system is complicated and we have hundreds of providers and a lot of different insurers. And we're trying to get everyone in that direction so that financial barriers don't get in the way of someone who needs a test getting one. She said, when that happens, however that happens, it is a concern for us. Here's what you need to know about avoiding costs associated with testing and how to get them covered if you are billed. You should be charged for a COVID-19 test. Should you be charged for a COVID-19 test? Freudian slip. No. You shouldn't be charged for a COVID-19 diagnostic test. Federal law requires tests and any associated office visit costs to be covered by insurance companies without what's called cost sharing. In plain English, that means it shouldn't cost you anything. Minnesota's private health insurance companies have committed to these rules indefinitely. States continue to reopen. Some office workers fear COVID-19 exposure retaliation. More people are returning to work. 4 things to know about your rights. If you get your insurance through Medicare or Medicaid, you shouldn't be charged either. To avoid charges, you need a doctor's referral for the test, and it needs to be in your insurance company's network. Okay, so the doctor's referral is going to still cost you a copay. Forward. Meanwhile, the state periodically opens pop-up testing sites around the state that bypass insurance altogether. The tests there are free and covered by the state. Who can get a test at no cost? Coverage for COVID-19 testing is predicated on state guidance around who should be tested. That's what doctors are following as they decide who should be referred for a test. Early in the pandemic, testing was limited to only certain people: hospital patients, people in congregate care settings, and healthcare workers, because supplies and testing capacity were limited. But as the state has expanded its testing capacity, it's also expanded the pool of people who qualify to be tested. As of today, people with COVID-19 symptoms can be tested, and so can people who are asymptomatic if they've had a known exposure to the virus. Determining whether someone has had a known exposure can be difficult for some providers to determine, said Rydrick. It's a bit more of a trust exercise that if someone goes in and stipulates that they are a contact of a positive person, she said, we don't have a mechanism to generate confirmation for everyone. However, if testing resources are limited, providers can prioritize people who are at the highest risk of spreading the virus or experiencing severe symptoms, which means that it's possible someone who is asymptomatic but thinks they've been exposed to the virus might not get tested on a given day. Wow, it's so many questions around this testing, you guys. This is what really makes it's like, as Americans, we've always heard that the United States is the most advanced country. It's the most technologically savvy. It's the most medically advanced. They're doing, okay, there's another plane. They're doing things in the USA that no one else is doing. People are leaving their countries and coming to the USA for certain surgeries, this, that, and the third, blah, blah, blah. But as we see here in this article and many others, the United States is still completely unprepared for this pandemic. The United States is behind all so-called third world countries. All so-called third world countries, the United States is coming in behind when it comes to healthcare for COVID-19, you guys. What's going on here? It's too many ifs, ands, and buts about this, in my opinion. Okay. First, the guidance around who can get a test has changed over the months, and sometimes providers aren't up to date on who the state recommends get tested. See what I mean? In early June, when state officials said people participating in large gatherings around George Floyd's death could get tested even if they had no symptoms, it's not clear that all providers were immediately following that guidance. For instance, Health Partners said that because the rules around who should be tested are changing rapidly, some people may be charged inadvertently. In Roush's case, it's possible the provider charged for the appointment. The health department said that that's not in the spirit of the federal rules around billing for this testing, though there's no good regulatory mechanism for preventing that. For its part, Blue Cross Blue Shield, Roush's insurer, said it is encouraging providers in its network to make sure patients know they can get a free test if it is ordered by a doctor. What does that mean? If it is ordered by a doctor. For all of you out there who have gone to a doctor, for instance, you fall and hit your head. You got to go to your doctor and they give you a referral. They give you an order to go to, or an order to be referred to a neurologist. Then they'll say, oh, this person needs an EKG and EEG, so on and so forth. But guess what? You have to go to the doctor and pay that copay first. And when you get to that other doctor that you've been referred to, you're also usually paying a heavier copay, especially when it's a specialist. So obviously this is not free, you guys. You know what I'm saying? Why is it that a doctor has to be the one who orders a test for you? That doesn't really make any sense. How can I dispute a bill? All of Minnesota's insurers said that if your test is ordered by a physician, you should not be charged. You should not be charged. Okay. That includes people who are Medicare, Medicaid, or Minnesota Care. But if you are charged, they say you should first dispute the charge through their billing departments. You can also file a complaint with the Minnesota Department of Commerce at 539-1600 or email the department at consumerprotection@state.mn.us. Correction, as of July 8, 2020. An earlier version of this story incorrectly included an end date to Minnesota health insurance companies' commitment to waiving patient fees for COVID-19 testing. The story has been updated. Okay. COVID-19 in Minnesota. Cases confirmed 53,692, hospitalized 298, no longer isolated 46,965. Okay. All right. I'm going to go ahead and close out here. You guys enjoy the rest of your day. I'll be uploading this shortly.